Hello, my name is Justyna Kowalska and I am HIV care provider. So I am now for the proposition of virtual care. So since early beginning of the epidemic, Europe was hit hard with it, and we've seen an increasing number of healthcare problems. As an HIV physician, I was really afraid I will not be able to deliver care to my patients. As you can see on this slide, HIV care system has been overburdened because infectious disease specialists were involved in COVID care. So you can see that in our Central and Eastern Europe region, half of HIV physicians were also involved in COVID. And I was able to still continue care for my patients strictly because I had access to telemedicine. This month, I've been doing 400 visits and half of them through telemedicine. And I was wondering in the beginning if this won't be a problem for my patients, especially for women. And luckily, there has been a nice interview with Biostat in 2019, showing that if you ask people if they know what the telemedicine is, only 30% of Polish population didn't know the concept at all. So we already had 70% of people on board. And when we discuss telemedicine, of course, we are afraid that we need access to devices. Here you can see how the ownership of smartphones was increasing over the time in Poland. And you could see the increase was significant, but also it was almost the same in all different age ranges. On the right-hand side, you can see what people are using smartphones for, and you can see they are using them for apps, maps, GPS, more and more often. I'm sure we can use it for medical devices as well. When you look into the age distribution in women diagnosed with HIV, you can also see that there is a lot of young women, and that the distribution of age is across all the different ages that you can involve with using smartphone or any other device. So that's very important. Another thing is we always fear whether we are able to sustain retention in care. And I believe telemedicine is going to help us a lot with it. Just have a look when we interviewed our region, what across different levels of continuum of care, where are the hard to reach population. You could see in green that women are definitely hard to reach with HIV testing, linkage and starting card, especially in Central Europe, but they are not being listed for retention. So we can keep retention with a little help to them. Secondly, there is a lot of challenges for women living with HIV, and we can see they cross all possible areas and areas of life and activity, both family and job related. And I strongly believe that we can address some of these issues by telemedicine, providing patients more intimacy, providing them a choice of a time and a place to meet. They can call us, they can Skype us from their private space, they can do it from the office, they can do it from different spaces. We are not limiting them with that. So I had my patients calling me from really different areas. Some were caring for children because children were also set home for teleschooling. Some were calling me from work, the others from shop when they were doing groceries or something else. I strongly believe that telemedicine would help us to fight stigma, increase quality of life, also help women with caring for children and their families. So that is extremely important. Moreover, we need to say that telemedicine is for many regions a new tool. it is a wider tool than just having a telephone conversation. So there are many new initiatives we need to start, many apps that we should provide our patients with. We can try to use it for cardiological assessment. We can try to use it for blood pressure, regular checkups. We also can involve people more into their self-assessment, self-health caring. And what I'm showing here is this CDC, the CDC advertisement of telehealth. And definitely, this is going to be a tool that we will start to use permanently. I can't imagine my health going further without having this tool. So I'm definitely for having this option. And I believe this is suitable for women of all ages, for different occupations, for those who are staying at home with children, for those who are active at work, and those who are shy, and those who are really loud and happy to socialize. So vote for telemedicine.